Hello everyone, this is Dr. Van Merkel, founder of Science-Based Nutrition. I'm doing a quick little webinar here, a little training on dipsticks, the urinary dipstick that you use. And for years there's always a brand I used, a well-known brand, a medical brand. And after lecturing for a while, some of the doctors said, I'm ripping them off because I'm charging them, I don't know, 50 bucks for a container of 50 of these test strips. And they said they can get the same thing online for $10 or $15 at Amazon. And so we bought some and started using them. And my staff in my clinic here started saying the results aren't working. The results don't make sense and that there's something wrong. So I told them, okay, use these cheap ones and then compare them with the brands that we've been using and then correlate that with the blood test. Well, we did that and we found some interesting discrepancies. The cheap ones are cheap for a reason. They're not doing the job. And here's a great example right here. Let me see if I can get in front of the camera. You see where the cheap one here didn't detect high leukocytes. High leukocytes is what? Yeah, urinary tract infection, kidney infection. And it didn't detect them. And so here is our regular strip that we use, and here's your cheap one, which means if you're using a cheap stick, and this isn't the only change we found, it was on this patient, but this is a great example. If you are using the cheap sticks, they're cheap for a reason. Oops, they're cheap for a reason. They're not doing the job. You're not finding things. She might think you're saving money. Ooh, you're saving money because they're only 10 bucks for 100. Which means these are only $1 a piece. These are $2 a piece. $1 a piece, $2 a piece. But you're missing urinary tract infections and other conditions. Is it worth $1? If it's worth $1, you're a pathetic doctor. Let me tell you that. You need to get good quality things like we use, that we sell. You can buy cheap, but you're not going to be doing a job. So quit the crap. Start getting good products. Find the problem, because if you're not finding the problem, it's a wasted test. So the ones that we use, you don't know what brand we use, check it out. But we have discount rates because we buy in volume. So that's my thing on Dipstick. You ought to be using them on all of your patients. Do remember during the lecture that according to American Diabetic Association, every adult should have a urinary dipstick every 6 months, because kidney disease is so rampant and diabetes is so prevalent. So right there, and you're going to find out, if you remember during the lecture, 30% of all of your adults are going to have a positive urinary dipstick, a positive one, but not if you're using cheap stuff. So anyway, that's Dr. Merkel. Get out there and help people. Hope you have a good day, and I'm Dr. Merkel.